as a transgender person and as an autistic person, navigating healthcare is quite a feat. In order for me to receive my hormones, I have to have a diagnosis of gender identity disorder on my or gender dysphoria on my medical record. And having that in conjunction with something like autism that prevent that leaves me vulnerable to all sorts of biases, not just in relation to my disabilities, but also in relation to my being trans. And so I've had to make the hard decision to just keep my transgender identity on my medical record because I kind of have to in order to receive my hormones. So I've had to opt to withhold my autism diagnosis from my medical providers, even though it would be very helpful for them to understand this aspect of who I am. But I am in fear of, any kind of future bias or discrimination I might experience as I go throughout healthcare. Um, so in order for me to get the kind of support that I need as an autistic person, I have to phrase my questions or my support requests very delicately. I have to say things like, "Oh, I have a hard time with understanding verbal instructions. Could you give me written instructions instead of saying, oh, I am autistic and so I need this kind of support." So I have to express the need for support without mentioning why I need that support. And so I think that is one thing that people need to consider with when whenever they're advocating for healthcare access for autistic people, is just the layers that we have to deal with.